Hello, and welcome to the Sigma Gamma Rho 22-minute chat session. My name is Soror Jacqueline Greeley. Sigma Gamma Rho is proud to partner with the All of Us research program for precision medicine. The program is a historic effort to gather data from 1 million persons from diverse backgrounds to accelerate research and improve health. The goal is to find ways to treat and prevent disease in our community. These sessions are meant to provide you with valuable information while navigating the current COVID 19 health crisis. Today, we are going to be speaking with Dr. Oriaku Kas-Osoku, affectionately known as Dr. Kaz. She is a pediatric and adolescent medicine physician who works for the University of Nevada, Las Vegas School of Medicine. She is currently an assistant professor of pediatrics and the pediatric residency program director. She works closely with medical students and residents. She primarily works outpatient, but has seen the impact of COVID 19 on the pediatric population from various aspects. She is a member of Mu Rho Sigma Alumni Chapter and is the Western Region Rower Advisor. I am pleased to have Soror Dr. Kaz here to discuss pediatrics and COVID 19. Dr. Kaz, how are you?
Excellent. Thank you so much for that wonderful introduction. Hello, Sorors. I wanted to talk a little bit about COVID-19 and pediatrics. First, I'm going to cover a little bit of the symptoms that might present, some of the secondary effects of COVID, and then talk a little bit about some recommendations.
Okay, great.
So as far as symptoms of COVID-19, again, this can look the same as it does in adults. So you can see fever or chills, some cough, shortness of breath, difficulty breathing, some fatigue, muscle or body aches, headaches, congestion, runny nose, sore throat. You can also have nausea, vomiting, diarrhea, and of course, the infamous loss of taste or smell. Now, of course, this list isn't exhaustive, but we should be looking for these if we're considering someone might have COVID-19. Although fewer children are getting sick from COVID compared to adults, they can be infected, get sick, and can spread it. Most at risk are babies under the age of 1 or children with underlying medical conditions, such as asthma, diabetes, genetic or neurologic disease, sickle cell, heart disease, immunosuppressed, or obesity. These are just to name a few. Children can get very sick and end up with multi-system inflammatory syndrome in children, which we call it MISC. It's a rare complication of COVID-19 or COVID-19 exposure. There's various organs or body parts that can become inflamed. Lately, it's been increasing in frequency and kids can get critically ill, usually requiring hospitalization. Some additional symptoms you might see are that your kid feels extra tired, very confused, they're unable to stay awake. You might notice bloodshot eyes, some pain or pressure in the chest, or bluish lips and face. And don't forget, if they show up with a rash or have some abdominal pain, we should be concerned about this syndrome. Now, despite some of the ways they might present, there are secondary effects of COVID-19. Some of these include homelessness. Remember, the unemployment rate is super high. It's higher than it's been before, and it's primarily affecting Black and Brown populations. So this is even worse, especially if you rent or have mortgage, where more than 50% of your paycheck goes to pay it. It's leading to unstable housing and then separation of families. And as I've noticed at my homeless shelter, a lot of adolescent and young adult homelessness because there's no longer space. People have had to downsize. Another effect is food insecurity. It tends to be doubling in households with children. In some areas, it's even up to 40%. Remember that kids were spending quite a bit of time at school. There's school meal programs. They're being able to eat breakfast and lunch, but now they're having decreased access. They've lost about 50% of their calories. Although we've had some expansion in our federal programs like SNAPs and EBT, it's not making up for the large difference that we're starting to see. We need to be aware of some of our community resources like food banks, churches, community programs, and centers. As well as recently, kids haven't been attending school. So think about what's happening right now. We're ending up with low educational attainment, a low graduation rate. A lot of these kids are missing classes or days of school significantly more than they had in the past. Lately, we've been noticing that some of our older kids, especially our adolescents, are helping their younger siblings, spending less time doing their own work and not being able to accomplish the things that they set out to accomplish. They're entering the workforce, trying to help families to gain more funds to support the family overall. They're working more hours, spending less time doing their schoolwork. Now, let's not forget our special education population. Typically, when they attend school, they might be getting occupational therapy, physical therapy, speech therapy, but right now, they're not getting any of the resources that they would typically get. Our IEP kids, our 504 plan kids, they're not getting their resources at all. So a lot of things have been coming up in terms of how do we make an impact here. Some of the things include funding for summer school, along with how can we bring back some of our after school activities. Missing out on clubs, sports, service, it leads to a lot of loss and forgotten relationships that kids were establishing before.
Yeah.
Now, our rates of obesity have also increased. We're starting to see about a 3 to 4 increase in obesity. There's lots of pieces that are playing a role. Some of it is our food insecurity, our higher caloric intake. Remember, kids are starting to graze during the day instead of just eating regular meals and maybe some snacks in between. They're eating more fast food. So we're starting to see a high caloric intake even when they're only eating once per day. We notice some decreased physical activity. No one's getting outside. We're in quarantine. It's very challenging to get kids to maybe even work out at home. And then chronic stress. There's been a lot of death, a lot of loss during this time. We've got to think about this is triggering different responses in our body and leading to a decreased ability to regulate our weight. So some of these kids are also using food to cope. This is challenging. This is one of probably the hardest things to mitigate or stop, but we have to be paying attention to it so that it doesn't get out of control. Now, last but not least, there's been a significant rise in mental health issues. As I mentioned before, I primarily work with the adolescent population. I have noticed more than half of the kids I'm starting to see are coming in primarily to be assessed for anxiety and depression. There's a lot more kids I'm having to medically treat than I would in the past because we don't have the resources for therapy as we should in many areas across the US. So what can you do? I think it's really important that we start thinking about where are the resources in our community. Sometimes we may not have had to access them before, but it's key for us to know so that we can support others, even if we're not needing them ourselves. Where can you look up different things? Go to your public health department. Go to the Center for Disease Control and Prevention. Look up your state American Academy of Pediatrics website. There's lots of resources on there. This will give you the opportunity to find things that you may not have known existed in your area. Think about how to impact physical activity. Look at the beverages your kids are drinking. Try to reduce the calories by decreasing portion sizes. And last but not least, advocate for your kids, advocate for your teen, teach your teen how to advocate for themselves. This is our opportunity to impact the resources we're getting through schools, with all of our medical professionals. This is the time where we need to put in that effort. Spend a little extra time. Make sure your kids are sitting in class. Make sure you know what they're doing and not doing. And of course, let's figure out how we decrease stress. Now, I know some people are a little funny about meditation, but I'll tell you personally, it works. Yoga is great. There's tons of apps out there for exercise. Talk to your children about what they need and get them those resources. So last but not least, just COVID-19 prevention. Let's wear our face coverings. We all know this might be a little bit more challenging for our kids, but let's teach them, let's practice. Get them comfortable in doing so on a regular basis. Wash your hands with soap and water for 20 seconds. Best way to teach a kid to do this is pick a song. Get them to listen to it for 20 seconds. They'll never forget it and they'll remember it when they're washing their hands. So practice this at home. Don't go out and hang out with people who are sick. Avoid spending too much time with too many people in a room. Keep your distance about 6 feet apart for anybody outside your household. And then clean and disinfect high touch surface areas. Now, for those parents who have little kids, I know that's every area in your house, but do your best because kids can, again, they can spread it. So let's keep all of these areas as clean and disinfect as much as we can. And then if you get the opportunity, I'm always going to plug for vaccination, but we all know some of our populations are not getting the resources to even be able to be vaccinated. So I'm going to keep fighting for that. You keep fighting for that. And let's do what we have to do to continue to prevent COVID-19.
Wow, thank you so much, Sorcast. That was amazing. And for bringing up not just, the symptoms we should be mindful of in our children, but also what's affecting them. Like you mentioned, many of them um, would eat only at school or get a majority of their meals at school, or the homelessness, right? We know people, there have been laws put in place to prevent people from being kicked out of their homes, but after a year, that's starting to have an impact. So thank you for bringing to our remembrance of what is affecting our youth and how we can be interactive and resourceful to help them. Are there any other consequences that we should be aware of as it pertains to our youth and COVID-19?
Yeah, one of the big things I think we should start paying attention to is what our kids are doing when we're not there, because we all know a lot of us work. We don't have the opportunity to be there exactly when they're in school, especially our teenagers. We need to keep track of them. We have started to see a lot of higher rates of gonorrhea, chlamydia. It's important, and even pregnancy. So we need to keep track of them. We need to get them protected, and they need to be seen regularly as you would if we weren't in a pandemic. Let's not forget that piece of it.
That's a good point that you make, because we typically are not talking about the youth in this space, right? We're normally talking about teachers, parents, what's happening with going back to school, but that conversation about our youth in general has been missing. But to think that there will be an uptick of pregnancies, not just from adults, but from youth as well, and other STIs and STDs. That's something that we really need to start turning our focus towards, or, it's going to get out of control.
Mm-hmm.
Um, Good. Thank you for that again. And then lastly, would you have any advice uh, to give to parents and or the youth who will be listening to this?
I think my biggest advice would be to take control of what you do have and what you don't have. And what I mean by that is that figure out what you need and talk to the people who can give it to you, because we're still entitled to the resources we're supposed to be getting, whether we're in school or out of school. So we need to figure out how to get our kids the resources, but also teach our kids to get it for themselves, because teenagers, they have a voice and they know how to speak up for themselves, and we need to continue to teach them to do so, whether it's talking to their teacher, whether it's talking to their doctor, whether it's finding a way to get to the nearest, I don't know, library or whatnot, what may be open in your city to help support not only your family, but what they need to get through the rest of this academic year.
Good. All right. And so, as we are in this series, can you share with us how this impacts clinical research, Black healthcare, and the All of Us research program?
As we know, there's a huge health equity gap. As I've noticed, there's a lot of secondary effects of COVID-19. This is our opportunity to study what is happening with our youth and how we need to rectify some of the resources we may or may not have in our communities to support them. So I think that all of these areas can be touched on from a research perspective, can help close the health equity gap and deal with some of the racial health disparities that we have in our communities.
Great. Thank you so much. I have enjoyed this conversation so much, and I think it will be valuable to our Stigma family. And thank you so much for sharing your expertise today.
Thank you for having me. I appreciate y'all.
Thank you. Now, stay tuned for a brief presentation about the NIH All of Us Research Program.
We are one nation, one people. When called upon to give from within, we come together and find that our capacity to help others is limitless. What lies inside all of us is more than data. It's life. It's more than insight and medical research. It's vision and honor and compassion. What's flowing through America's veins is its diversity. The next great breakthrough will be found in each and every one of us. And what we find there will unlock mysteries, heal the sick, and eradicate disease. We ask for 1 million individuals to come forward and stand on this landmark in history. All of us are different, and it's those very differences that will lead to answers for generations to come.